Hey everyone, we started EHC Today to keep you informed on strategic initiatives and topics impacting the work that you do every day at Encompass Health. During this unpredictable time, we understand that social distancing guidelines simply don't apply to healthcare workers, but that's where our teams have truly stepped up. That's where you have demonstrated the Encompass Health way. I sat down with our Chief Medical Officer, Dr. Lisa Charbonneau, to learn more about how our values have taken the spotlight at our hospitals despite the COVID-19 pandemic. Take a look. Okay, so Dr. Charbonneau, thank you so much for sitting down with us today. I was wondering if you could kick us off by saying, in a few words, what does it really mean to lead with empathy?
Leading with empathy to me really means putting our patients first and coming into work every day as our wonderful clinicians do, regardless of what's going on in their own lives and in their own families, and coming into work to take care of our patients and tend to their needs and help them through their sometimes devastating, life-changing injuries or illnesses that have caused them to need our services in the first place.
So can you give us a little bit more then on maybe how you've seen employees leading with empathy throughout the organization?
So what I've really been impressed with is the ability of our employees to come together at a time like this when we really do need all hands on deck and collaborate and ask questions and make sure that they are following the recommendations closely and safeguarding our patients and our valued employees as best as we can.
That's great. So you've seen a good response in terms of people really coming together and wanting to work together appropriately throughout this.
Yes, and one of our values is doing the right thing, and that's really what I've seen is concern with the questions that we're seeing from the field about making sure that they are following the recommendations of the CDC correctly and following through with their local health departments when needed to safeguard our employees and our patients as best as we possibly can.
Thank you so much for summing that up so well. Our employees are not only leading with empathy, but they are doing what's right and following the guidelines, not only from the company, but of course from the CDC. And so I think that's just a good way to wrap us up. I really appreciate you coming out today to talk through this with us, and I hope that employees can get a good glimpse into what we're doing company-wide.
Thank you so much.